here to talk about the Envella Air-Fluidized bed, which is appropriate for patients with complex skin and wound issues. It is very important that you ensure the bed is plugged in and that the fluidization is running. The Envella Air-Fluidized bed may accommodate patients weighing 70 to 350 pounds. It is recommended to use a loose, flat sheet to protect the bed and to help you with repositioning and turning your patients. It is important when you place a patient to line their hips up with the hip alignment indicators located here on either side of the bed. The side rails on the Envella Air-Fluidized bed are a little different than you may be used to. These are not a side rail that drop to the side of the bed. You will actually remove the side rail when you need to work with your patient. To do so, simply walk up to your side rail, slide the mechanism over to unlock, and lift your side rail. The side rails are capable of standing on their own. When you've completed your patient care and it's time to reinsert the side rails, you will see that they are color-coded. The green goes in the green, the blue goes in the blue. You'll hear a click, and you'll hear a beep, indicating that the operation has been done correctly. In the event you have to perform CPR, you will pull the CPR lever located on either side of the bed here. When you do this, it will lower the head of the bed, remove the air from the head section, and stop fluidization so that you may perform CPR. To turn fluidization on or off, you have a few locations in which to do so. You may do this at the head end side rail in the caregiver control. You may do this at the foot section, and you may also do this with the use of a hands-free foot pedal. So in the event you're working with your patient and you need to stop fluidization, simply step on the pedal and it will stop fluidization. Brake and steer. The brake and steer pedals are located at the head end and at the foot end of the bed. To put the bed into neutral, step on the green pedal until it's horizontal with the floor. To put the bed into steer, put the green pedal all the way to the floor. To set the brake, simply step on the orange pedal. Now let's review some functionality of the color touchscreen. If you're looking at the color touchscreen, in the upper right-hand corner, you'll see a home button. The home button always takes you back to the home screen. Additionally, in the bottom right-hand corner, you will see a question mark. The question mark is a built-in user manual. So if you have any questions on how to safely operate this bed, please look at that user manual. First, if your patient is considered a fall risk and your hospital policy requires a bed exit alarm to be engaged, you have the option to do so. Under the Bell tab, you have the ability to set an out-of-bed alarm. So your patient is in the bed, you hit bed exit, and you hit out of bed. You will hear one chirp, and that will be your indication that the bed exit alarm has been set. There is also a scale icon, and when you open that scale icon, you will see several functions. First is zeroing the scale. Your Hillrom technician may have already zeroed the scale for you. If you need to zero the scale, however, you would simply push 0. It would remind you that the bed should be unoccupied when you're zeroing and have your appropriate linen per your hospital policy on the bed at the time you zero it. I'm going to confirm that that's the case. Tells me to let go of the bed and the scale is calibrating. So the scale has now been zeroed. I will hit OK. And now it is appropriate, once your patient is placed in the bed, to weigh the patient. To do so, simply push the button that says weigh. It will then weigh your patient, and it will display a weight to you. And if that weight seems reasonable for that patient, hit accept. Let's talk about the fluidization tab, which is located right here under the scale. This is where you are able to adjust the temperature and comfort. To adjust the temperature, tap the temperature tab, and you can adjust the temperature from 86 to 100 degrees Fahrenheit. If you need to make an adjustment to Celsius, you can do so by pushing this button here and toggling to Celsius. Also on the fluidization tab, you have the ability to control the rate of fluidization. Simply tap the comfort button, and here you will have a few choices. The patient can firm the head section to their liking. You as a caregiver can adjust for them. They can also adjust on a pendant that they have in their hands. You may also adjust the fluidization to low, medium, or high, per the patient's preference. It will not affect the clinical efficacy of the product. There are a few additional controls above the color touchscreen. You will see there is a button that indicates a surface transfer and a side transfer. This will aid you in doing a lateral transfer to get a patient from bed to stretcher. It will also assist you in getting a patient to an egress position if you use the side transfer button. You have the ability to raise and lower the head of the bed from this control panel as well. And you also have the ability to raise the high-low of the bed for a comfortable working height. Note the reason that this light is flashing amber, it is indicating that the bed is not in the lowest position. When you leave your patient's room, you should ensure that the bed is in the low position and that this light is not illuminated. Finally, you have your therapy button. This is another location where you can turn your fluidization on or off. Ensure before you leave your patient's room that you have pushed the therapy button and that it is green and that your therapy has started. If your patient has tube feeding or ventilator, you can set an alarm to ensure that the head of the bed doesn't go below 30 or 45 degrees. To do so, touch the bell tab, go to head of bed angle. I'm going to select below 45 degrees. And you're seeing that the head of bed angle is being armed. I will hit OK. And now we have a head of bed angle alarm of 45. If I were to lower the head of the bed below 45 degrees, you will hear an audible alarm. As a caregiver, you can come in the room, make the adjustment above 45 degrees, and the alarm resets. In the event you want to lock the patient's ability to raise or lower the head section of the bed, simply push and hold simultaneously the padlock button and the button you wish to lock. And the light is illuminated, indicating to you that that function is now locked. To unlock that function, simply push on the padlock at the same time you push the button simultaneously, and now that feature is active again. If you have additional questions, please contact your local Hillrom representative. We also encourage you to take the Envella e-learning module located at hillrom.com. Thank you.